Hi, my name is Lyle Murphy, the founder of the Alternative to Med Center. And today we're going to be talking about trazodone. First question is, what is trazodone used for? So trazodone is a tetracyclic antidepressant. It is used to treat depression. However, especially recently, it has been given quite copiously as a sleep aid. Next question, does trazodone help with anxiety? It does moderately. I mean, it's not like a heavy sledgehammer like a Klonopin or an Ativan or a Xanax. It's not that kind of anti-anxiety medication, and it is certainly less addictive than the benzodiazepine class. So it might be a better choice for anxiety than some of those more addictive medications. Next question, what are some of the natural trazodone alternatives? Well, I'm very glad you asked because this is what we do here. So, and this is actually on the website, Alternative to Meds, if you go to the page called Trazodone Alternatives. So on that list, we have things that have been researched out that have citations and credibility behind them. First one would be individual cognitive behavioral therapy, dialectical behavioral therapy, exercise. As far as supplementation, tryptophan is one of the direct precursors to serotonin. Tryptophan also helps with sleep because serotonin forms melatonin on the north side of the brain barrier. SAMe. SAMe, you would not want to take this if anxiety was your predominant feature, or if you do take it, you'd want to take it in much smaller doses than like maybe 50 milligrams as opposed to 100 or 200 milligrams, because SAMe could kick off more anxiety. Omega fatty acids, vitamin D, testing for and clearing out neurotoxins lodged in the body. This is kind of a broad scope of what we do here at Alternative to Med Center. There are, well, the brain is a biochemical organ, and it works off of chemistry. Well, there's also other chemicals such as pesticides, mercury, and other things that can impair the way that that chemistry works. For instance, the way an organophosphate, which is a pesticide, kills a grasshopper is it knocks out its nervous system. And it knocks out its nervous system in a very specific way. It poisons an enzyme called the acetylcholine esterase enzyme, so that when the stimulatory neurochemical acetylcholine is released into the synapse, opens up the sodium channels, and you get depolarization of that nerve. The enzyme that normally pulls that acetylcholine back off is not there. The nerve channel stays stuck wide open, and the insect goes into tetany and dies. Strangely enough, we use acetylcholine and acetylcholine esterase and the same sodium ions that make the synapses work in us. We have livers and detoxification mechanisms that allow us to endure more of that than, let's say, a grasshopper, but yet we still are prone to this type of toxicity and this type of alteration in our neurochemistry, the way it works, and these poisons can cause us to have anxiety as well. Next thing, acupuncture, controlled breathing techniques, biofeedback, dietary changes, especially ones that get you on more organic food, things that have the right components of vitamins and minerals, certain herbal supplements such as St. John's wort, just getting out in the fresh air and sunshine, yoga, reflexology, massage therapy, sound and music therapy, and things that support a healthy microbiome with probiotics and a corrected diet. And if sleep is your main issue, you might want to look into what's called sleep hygiene, blue blocking glasses, turning off your electronic and your EMF in your house at night, and various things. Next question, what are trazodone side effects? So side effects that are reasonably common yet are concerning enough to where you should run to your doctor and get some answers on what's happening would be blurred vision, confusion, dizziness, faintness, or any type of lightheadedness, especially when getting up or moving about from a sitting position or a lying position to a standing position, and you get demonstrably dizzy, sweating, or unusually tired or weak. Those are more concerning and common that might alleviate as you take the medication more, or things that, I don't know, I guess people just maybe get accustomed to, is dry mouth, muscle or bone pain, trouble sleeping, trouble remembering, or unpleasant taste in their mouth. Next question, how long do you sleep on trazodone? Well, trazodone, okay, so even though it's prescribed sometimes as an antidepressant, if you want to stay not depressed because of a medication for the duration of a whole day, trazodone is not necessarily the best medication for that because the half-life is only 5 to 9 hours. However, as a sleep aid, 5 to 9 hours is the amount of time that you would want a medication to work to help you with sleep, and of course not much longer than that, otherwise you'd have a hangover the next day. So trazodone would help you sleep, 5 to 9 hours if it was well tolerated for you. Next question, how long does trazodone stay in your system? Typically you're looking at the half-life of the medication, so half of it's cleared your system in 5 to 9 hours, and overall it should be gone in about 3 or 4 days, to the point where a standard urine drug test would not be able to detect it. Next question, what class of drugs is trazodone? Well, how they named this drug really is on the structure, the chemical structure of the drug. Then there's 4 cyclical carbon rings, and then 4, the way to nomenclature that in Latin is tetra, so it is a tetracyclic antidepressant. Well, interestingly enough, it actually has a bit of a smattering of different reactions. There's at least 4 of them that are believed mechanisms of how the drug works. So it is a sort of a agonist, means that it helps a certain thing, and antagonist means it blocks a certain thing. So trazodone is a bit of a mixed antagonist and agonist of certain serotonin receptors. It is a blocker or an antagonist of adrenergic, which means basically stimulatory type of neurochemicals. It's a weak blocker of the H1 histamine receptor, and it is also a weak serotonin reuptake inhibitor. So it's not, even though it has some serotonin reuptake inhibiting activity to it, it's not really functioning like most of the SRI medications. Next question, trazodone side effects in the elderly. Older adults are a lot more prone to the tiredness, sleepiness, dizziness, drowsiness, and also on an EKG, they may have a prolonged space in what's called the QT wave. Next question, is trazodone addictive? Another definition in terms, addictive by and large means when you take it, you want more of it, and then you want more of it, and then you want more of it, and even if there's a lot of consequences, you still probably want more of it. Of course, trazodone is not that type of medication. However, you can develop a dependence to it. On the scale of how bad people's dependence can get on a medication like this, it's on the lower scale, but we have seen people that have some pretty wacky things happen, especially when they're trying to get off of it because of that tendency to become dependent on it. Next question, trazodone withdrawal symptoms. Honestly, we would be here for a long time if we go into all of the different type of withdrawal symptoms that a medication like this has, but generally you're going to see the things come back in sort of a rebound fashion that you started taking the medication for in the first place. If you were taking it for sleep, then as you stop the medication, you might see problems with your sleep. Hopefully it's of short duration, but that's probably where it's going to go for you. If you were anxious, you might see a resurgence in your anxiety. If you're depressed, you might see a resurgence in your depression. But don't be surprised if you have some mood swings, anger, aggression, sort of the kind of reactions, maybe crying spells, but a lot more agitation. If you're getting brain zaps or the sensations of electrical shocks or jolts in your system, that unfortunately is not truly uncommon. However, that is a clear indication that you're probably going too fast coming off the medication, and or you might need to do some direct amino acid supplementation that helps build up your serotonin pathway and other pathways so that you can endure this medication withdrawal. Some people might find that they have suicidality, hypomania, hallucinations, dizziness, nausea, vomiting, and other gastrointestinal sort of symptomatology, diarrhea, headaches, muscle aches, and or weakness. And that pretty much covers what we were going to talk about today as far as trazodone. I really thank you for spending time with us. And please, if you are going to change your medication, please talk to your prescriber. You're more than welcome to bring some of this information to your prescriber as a bit of talking points, but don't change your medication based upon what you've heard here without some sort of person that is a prescriber monitoring that. Thank you very much for spending time with us today, and be sure to like or subscribe wherever that is on the page, and call the number if you need any more support for your particular situation. Thank you very much, and have a good day or night.
Thank you for watching. Don't forget to subscribe to our channel. For information about Alternative to Med Center, give us a call at 888-984-9667.